When is IUI commonly recommended? When is IVF recommended? Which fertility treatment is right for you? Hi everyone, I'm Dr. Prashant Joshi, Consultant Fertility and IVF Specialist at Cloudnine Fertility, Jayanagar, Bangalore. Today we are diving into one of the most common questions couples ask when they are trying to conceive with medical help. Should I go for IUI or IVF? Both treatments are widely used, but they are very different in their approach, cost and success rates. By the end of this video, you will have a clear picture of which option might be right for you and someone you know. Don't forget to like this video, subscribe and hit the bell icon so you don't miss on our upcoming fertility education videos. So let me explain what is IUI. IUI stands for intrauterine insemination. Here's how it works. The women may take mild fertility medications to stimulate the ovaries. Around the time of ovulation, washed and concentrated sperm from the partner or donor are placed directly into the uterus using a thin catheter. The idea is simple: get the sperm closer to the egg, increasing the chances of fertilization. IUI is quick, usually painless, and doesn't require anesthesia. When is IUI commonly recommended? Unexplained infertility, mild male factor infertility, issues with the cervical mucus, single women or same-sex couples using donor sperm. The success rate of IUI per cycle is around 10 to 20% depending on the woman's age and fertility factors. Now let's see what is IVF. IVF or in vitro fertilization is more advanced. Here's the process in brief. The woman takes stronger medications to grow multiple eggs. These eggs are retrieved under light anesthesia. In the lab, eggs are combined with the sperm to create embryos. After a few days of growth, one or more embryos are transferred into the uterus. IVF allows doctors to carefully monitor embryo development, test the embryos for genetic conditions, and even freeze extra embryos for later use. When is IVF recommended? Blocked or damaged fallopian tubes, severe male factor infertility, endometriosis, repeated failed IUIs, older maternal age, or low ovarian reserve. The success of IVF varies, but on average, it is around 50 to 60% per cycle for women under the age of 35 and lower as the age increases. Now let's break down the key differences between IUI and IVF. The first one, procedure complexity. IUI is simple, it's quick, it's done in the clinic without anesthesia. IVF involves injections, egg retrieval, lab fertilization and embryo transfer. The second factor is the cost. IUI is generally much cheaper, often just a fraction of the cost of IVF, whereas IVF is more expensive because of the lab procedures and medications. The third part is the success rates. IUI, there is lower success rate per cycle, around 10 to 20%, whereas IVF, there is higher success rate per cycle, 50 to 60% or more depending on the age. The number of cycles. Many couples try several IUIs before moving to IVF. IVF may be chosen earlier if the time is critical, such as in a woman over the age of 38 years. The fifth factor is the control. IUI relies on nature for fertilization, whereas IVF gives doctors much more control from fertilization to embryo selection. So let's see which fertility treatment is right for you. If you are younger, have open fallopian tubes, mild fertility issues, starting with IUI makes sense. It's less invasive, more affordable, and sometimes that's all it takes. If you have more complex fertility challenges like blocked tubes, severe sperm problems, or you've already tried IUIs without success, IVF may give you a higher chance of success. Remember, there's no one-size-fits-all answer. Your fertility specialist will recommend the best approach based on your medical history, tests, results and goals. So friends, IUI and IVF are both powerful tools to help people build families. The key is understanding where you are in your fertility journey and making informed choices with your doctor. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and subscribe for more clear, science-backed fertility content. Thanks for watching and wishing you the very best on your journey.